The broadcast is now starting in listen-only mode.
Hello and welcome. My name is Julie and I'm with AVCSuccess. Thank you for taking the time to attend this webinar. The topic today is Super Items Review. This is the first in a series of webinars between AVCSuccess and DVMAX this year, and we are pleased that you could join us. A couple of reminders before we get started. First, everyone's audio has been set to mute to keep down the background noise. Please submit questions or comments using the questions box, and we will save some time at the end of the presentation today to answer any questions submitted. Secondly, the presentation is being recorded and it will be sent to you following the webinar. Please feel free to share this link with others in your practice who are unable to attend today. Our speakers today are Kim Fish, Scott Anderson, and Terry Smith with AVCSuccess, and Katie Besner from DVMAX. Katie would like to share some information about DVMAX with you. Katie?
Hi, this is Katie with DVMAX. I'm within the Upgrades department. Just a few little points. DVMAX version 8.6 has been released. DVMAX version 8.6 is up to 2 times faster than version 7.0.12. And with this upgrade, you are able to use the latest operating systems for both Microsoft and Apple. And you can view your IDEX diagnostics results within one area. And there are many more IDEX to DVMAX integrations within the version of 8.6.
Thank you so much, Katie. Thanks for coming on. And we always open up for questions at the end. So if you guys have anything, you can put it up in the questions box, as Julie talked about. And Katie is here to help answer anything on the DVMAX side. But thank you very much for joining us. We've been doing these webinars for quite a few years now with DVMAX. We're really happy to have that relationship because it's all about how do you take your DVMAX system and use it to its full optimization to really help you institute your medical protocols and create consistency and in the end perform as well as you can. So who are we? What do we do? Some of you guys have been on for many of our webinars in the past, and for some of you it's your very first time, so welcome. And so an introduction to us, we're a consulting team. There's 9 of us on the team, and we do specialize in the DVMAX system, as I said. We do everything from pulling reports from DVMAX and putting them into a version that it's not just Excel. We convert it into something that's a lot more kind of user-friendly, so you can take like hundreds of pages of data out of your DVMAX system and understand exactly what's happening. We like to really clearly review what the performance has been at the practice. Historically, we also look at real-time monitoring, and we look at some of the correlation patterns. We're going to talk about that today to understand how you guys are actually practicing with your system. When you have that information, then you can plan. What is working, what's not working, what are you going to do about it? Sometimes it requires to make sure your entire team is on the same page. That's where staff coaching comes in. And the other part is sometimes you just need consulting. What do you do to move your practice forward? For our practices that do the individual consulting program, we do an average of about a 16 to 18% growth, and we're also working on budgeting as well, so that profit margins are about a 14 to 18%. Whether you guys are planning on selling here soon or not for another 30 years, you always want to be considering the value of your practice. These things matter. Uptrends matter, your profit margin matters, and the medicine that you practice matters. So that's what we're here to do, is to help you guys optimize all of that. Now, this is a new program we're doing in 2018, so we're launching it here in January, where our monthly webinars are very specifically little snapshots of the modules that we do in our core consulting or individual consulting program. And so you guys get to have a taste of it. There is a theme that will go through the entire year, and I'll show you what the modules are all about in just a minute so you can see the breakdown of it. From there, you want to get a little bit deeper. There's the group coaching I'm going to talk about for a minute. Then, of course, the individual coaching, which has the maximum results. It's all about you guys reaching your peak performance. What is it you want for your practice? Do you have some isolated issues that you want to address? Do you need some real solid help to get you across that finish line? It does take a plan. It does take that team coaching, and it does take consulting to help guide you in what you need to do and why things are happening the way they are. That's how you can correct it. So just really quickly, I'll show you what your modules are that you can attend for this year, for 2018. These are all free. You guys get the invite every month, and now you know what all of the topics are going to be. Hopefully you can come on for all of them, because they do all relate to each other. It's kind of like putting your clinic through school. That was our original concept when we put our consulting group together, that it's like taking mini courses. And each course needs to be completed to its fullest and stay in place. So usually when we're doing the consulting, not only do we introduce these modules, but we also help to make sure that the steps that were changed and the new processes are consistent and keep on being used, so they don't just get, it's like the excitement of New Year's resolutions that drop off. We don't want that. We want this to be like that kind of permanent ongoing change for you to help keep you driving forward. But you can see it's a lot of really good topics that are in here. Some of them might really strike a chord with you. And one of them here on the super items, the one we're on today, we're going to talk about exactly what the impact of focusing on your super items is all about. But there's some really good ones, and some of them are timed appropriate to the time of the year, like dental is next month. You guys have the oftentimes at least a dental awareness program, if not a dental special going on. It's a good time to address a module like that. One of the most important ones we have is actually going to be in November, the fee and code review. I'm going to talk about that one today, because in order to do your super items, you do need to be looking at your bill code list too, your bill item list, for one, the definition and use of those items, those codes, and also pricing structure. So even though these are modules that you won't get like the free webinar on until November, that may be one of the modules in the Design It Yourself program that you can say, hey, I want more information now about it, and you can join in on one of the group coaching, which is really cost effective, as we're going to talk about. So that's what this one is. So once you kind of are going through your free webinars, if there's something that you say, gosh, I want to do more in this area, then you've got the opportunity. You can join in with some other clinics, and the consultant that specializes in that topic will go through it with you, and it's like 2 meetings a month. And they have some different lengths depending on which one we're talking about. For instance, Terry's on with us, and she specializes in the client communication module, and that one's one of the longer ones. It's really intense. It totally focuses on transactions, getting your transaction volume up. But this may be a really good option for you, so consider it as you're going along, whether it's this module or something else, that you might want to get a more in-depth kind of review and assistance with getting through that topic to help you get your numbers up. And of course, if you want the maximum results, the individual coaching, which a lot of clinics do, obviously, our goal is to get you a 9 times ROI. Where are you going to find that? I don't even think you can get that in Bitcoin right now. So this one is a tried and true kind of process. We know statistically exactly what, if you do certain things, this will be the outcome. And that's why we're really confident in saying that's the kind of return on investment that you can have. You can't lose on a 9 times ROI. So definitely consider the individual consulting as well. So let's go ahead and get started on the module for today, the webinar for today, the super items. So it's very specific to DVMAX. Here's the goal. You want to increase your average charge per transaction. We call it the ACT for short. And there's a lot of different things that can affect it. Using your super items is one of the greatest positive impacts that you can have on getting consistency to your average charge. Okay, so that's why we're talking about the super items. You have to have it built properly, first of all, know how you're going to use it. And then the other part is, how do you present it to the client to get them to be compliant? Because it's not like if you build it, they will come. You have to build it and present it in a way that they're going to say, yes, I want to do this for my animal. Okay, that's how you get the conversion. So we're going to go over that. But I want you to see what the impact is of whether you pay attention to your average charge or you don't pay attention to your average charge. Now keep in mind that revenue is made up of 2 things. It's a combination of 2 things. One is your transactions. And I'm talking about overall hospital transactions. Okay, we're just looking at it collectively. The other is your average charge per transaction. You multiply those 2 together and you get your revenue. You want both of them to go up. If one goes up and one goes down, you have what we call a wash effect. That didn't really get you anywhere. What we like to do with the practice is first really focus on stabilizing the average charge. I'm going to show you in a minute what we're looking at on the screen. And from there, then keeping that stable, then you can go and increase your transactions, like the module, one of the modules that Terry specializes in. But you start here, okay? And that's why this is such a good topic to start the year with, because you want to know how you've been performing on your average charge. Now, you can pull your reports. You can, go through and chart it. By the way, we archive all of our webinars, and the one we did in December for the end of year, and all the reports you guys should be pulling so you can get this data. You might want to go back and watch. You can get it off of our website. It's archived up there. So we're kind of fast forwarding to here we have the data. When we do an exploratory analysis for a practice, which is what we do before consulting so that they can have this good picture of what's really happening at the practice, and of course we do this ongoing for our clients as well, this is one of the charts that we do. And just to give you color reference, I know because some of the labeling is a little bit small, the years go orange, purple, and then this kind of turquoise color, and theoretically or ideally you'd like the turquoise to be on the top. Now you can just tell from the colors here, this is what we call, Scott and I call jokingly, the ball of yarn. It's not the way it's supposed to look, okay? There's a lot of fluctuation, and there's a decline. I mean, this clinic went down over 5% in 2017 on its average charge. That sure isn't, showing any sort of sustainable growth, right? But even if you go back to the previous 2 years, when you look at it, I mean, look at the orange. Look at what kind of swing you have in here. This is a $45 swing, basically. There's no sustainability to that at all. You can get all excited about these high points, but there's no way they're going to be able to manage it, and that's proven here. Okay, purple, same thing. The blue keeps coming down. It's a little bit more consistent in here, but look at it, keeps pulling it down. And so what this is doing right here, if we were to cut off the rest of the kind of positive at the beginning of the year, this average charge in this practice is trying to sit at $125. Now, all of you guys are different, okay? You could be 95. You could be, we've got a clinic at 240. There's a huge range. What matters is with your practice, what is your swing? Are you within $10? If you're within a $10 swing, you've got potential for growth. If you look like this, there's no telling what it's going to end up being, and it certainly has the potential to come down. This is why you need to know before you do anything where you're at, right? This is you getting a baseline. You guys do blood work. A lot of times you do blood work for baseline, right? It's the same concept. So we want to know where we're starting at, so then we can have a goal of where to go. In this clinic's case, because the real trend is hitting at 125 when this thing's all said and done, the goal would be to get that swing to be within $10, and then to get it to go to 135. Get it back up to where it was, but a nice, sustainable, growth pattern where, we don't have that giant swing, that it's sitting between the 130 and the 140, because then we can keep moving it. But what happens in this clinic's case, and I understand their situation of why it happened, but they didn't have any consistency in their medical protocols. And for a lot of you guys, you don't. You may think you do, and that's part of our conversation today, is seeing what really is happening at the practice. But you want to know that you are. You want to have your setup in your DVMAX system so that you're using these super items effectively. We're trying to minimize as much error as possible. And then we're practicing consistent medicine with things. Okay, and this is where standard medical protocols come in. Now, I don't really talk about standard, protocols, in depth here. When you do the group coaching, that's one of the topics that gets covered to help you figure out what that would look like. And of course, we really expand on standards of care in one of the other modules. But figuring out what should be in those super items is also really important, and that's on the medicine end of it. Okay, so you want to first know where you're at with your average charge, okay? What's happening with your swing, where you're at, so that way as you work on super items here and really fine-tune this thing, then you come back and check it again and see what kind of growth that you had. Imagine for your practice, if you went up $10 on your average charge, what that could do to your growth. Now you keep that stable while you grow your transactions. That's exactly how we achieve for our clinics the 16 to 18% revenue growth in the face of about a 3% national average. And then ask yourself where you're at. Okay. Anybody else want to contribute? I know, Terry, you're in the background there. Scott, you're there? Yeah, go ahead, Terry.
Oh yes, I was just gonna add that, yeah, definitely in the communications section that I review with the practice, we definitely are looking at, consistent communication, keep those transaction numbers up, keep those transactions level, the number of transactions level, so that we can try to prevent some of these peaks and valleys, not only from month to month, but from week to week.
It's a really good point, because when you have such fluctuation there, that just contributes to some sort of chaos over here, right? Some of you guys might have naturally felt that in December too, because while we would like to think that our well visits are coming in just like they always do, proportionately you end up getting more of the sick pets than the well pets. And that's going to kind of throw things off, because you get a lot more over-the-counter transactions and things like that. So it definitely dilutes your average charge. All sorts of things that play into it. But yeah, even down to the weekly, down to the daily, we track these things. Yeah, go ahead, Scott.
This is Scott. Thanks for everybody for coming on. But what Kim and Terry are saying is, your DVMAX system right now provides a ton of information, which we help to distill down to some key points. But when you look at communication, one of the reports that may print for you automatically at the end of the day, outlines every transaction that occurred during the day. As far as what was invoiced, how did they pay, et cetera, et cetera. And so to look at that report, and in my practice, we look at it periodically, not absolutely every day, but it does two things. One, to Terry's point, how did we communicate with this client, that came in, and our, reminders, that kind of thing, up to date. And then this other side of it is, if we had a case that came in that, how did we charge for it? Okay, did we charge for everything that would be associated? And an example Kim will probably use later is that in one of our actual consults, okay, we discovered in a 7-doctor practice that 2 of the doctors thought anesthesia was included, the cost of anesthesia was included in the price of the surgery, when it wasn't. Okay, and so the owner of that practice, I happened to be sitting next to him, almost fell off the chair, because this is where, when you look at the transaction reports, you can see, here's the case and here's what we charge for. And in my practice, as we periodically look at that, we go through it, random day per week, and we'll actually bring up the client and patient in the DVMAX system. We'll make sure that we have future reminders out there. We make sure that we charge for everything that should have been charged for. And if we didn't, that's the basis for a super item. Okay? Defining ahead of time what you want to charge for certain procedures. Kim?
That's what it all comes down to. That's why you guys are here today. Put this puzzle together. Okay, so in going through this, like I said at the beginning, we've got 2 pieces. So the first is making sure your super items are the way that you want. So that's what we're going to cover first. Now, your bill items make up your super items, right? So you've got to go back and start with the bill items. Do you have everything that you really need in there, and cleaning that up? Like I said, we don't have that webinar until November, but you may want to do that module in a group coaching, because it's so important to go through and clean up your bill item list. Like, what is it that you actually want to use? You can archive the others and then have really clear definition of use on those. It's one of my favorite processes to go through with clinics, because it's so enlightening. Everybody thinks they've got their code list down until they actually go line by line through it. And it's always interesting to go through that process. But you've got to make sure your bill items are the way you want them, that everybody's clear on exactly when we use these things, because that's what's going to go into your super items. I'll give you just, a very quick example is going through your exam codes. Do you know the definition of use in all of your exam codes? For instance, if you've got a recheck exam, whatever you want to call it, what's your protocol on when you actually use that? If you have a brief exam, what's your protocol for use on that? If you have a free exam, what's your protocol on use for that? Some of you guys have, umpteen number of exams, which just makes it even more complicated as far as which ones get used when. And everybody's got to be on the same page with the definition of use. So make sure you look at that too. That's a very important piece. You can't do the rest of it until you've gone through the bill items. Okay? Make sure you understand what the definition of use is. All right, this little image, and I know it's small again, but you're going to get that color visual so you understand what we're talking about. In order to properly assess your super items, whether you're using them, not using them, how you're using them, all that, you have to kind of dig in a little bit and understand the accuracy of your use with them. Because people all the time say, oh yeah, we have a super item for that. And I say, are you using? And they say, yeah, I think most of the time we are. And so part of what we do in that exploratory analysis is not just those trend pattern charts, but it's also getting down and looking at how the individual bill items are actually being used and looking for correlation patterns there. So here's an example of a practice that's using, just it's a little willy-nilly of when they use the different dental codes. You want consistency, and consistency comes from how you set up your super items. So when you say, oh, I use them, and then we look at the correlation pattern and can see that it's not really being used because otherwise numbers would be matching up, that can be eye-opening for a practice. Like, oh, then we've got to say, well, why aren't you using it? Is it too complicated? Do you have duplications? Do you have more than one that looks so similar to each other? There can be so many reasons why people don't use them. So don't just assume that you guys are in 100% of the time. I mean, that's your goal. But you've got to find out if you really are. And if you're not, why not? Because you have to, before you ever have client compliance, you have to have internal compliance. Okay? Once you understand that, then you can go and properly clean up your super item list. Okay.
Kim, can I jump in here? This is Paul.
Sure. Let me go back to that. Thanks, Paul.
Sorry. I just wanted to emphasize kind of, as Kim noted, this is part of the exploratory analysis process that we do go through this data and kind of examine and highlight a bunch of stuff that's present like this so that we can find things that, in essence, merit more attention, that you want to look at and sort of confirm whether that's intentional or not. And if it's not intentional, to understand why it's happening and change that issue. Or change that behavior either by training, by standardizing the codes that you're using, or doing other things like that, so that can be accomplished. But that's one of those things, both with the sort of time-based charts and the in-depth analysis, the exploratory analysis does for a practice and is worth a lot because it helps to sort of double check on the things that are being done in the practice that are often taken for granted, but can be the source of some let's call it difficulties or awkwardness, as the example that Scott and Kim mentioned before with, the different doctors having different understandings of what was and wasn't included. The same thing happens here with the super items. It's very important to have everybody on the same page in terms of when they should be used and what they include.
Exactly. There's a bit of psychology to all of this, understanding, the why behind it. And this is, definitely the example that goes along with what Scott was saying with, the clinic that the anesthesia and surgery were not matching up. How do you know unless you're looking for correlation patterns? So you've got all this great data in your DVMAX system, but it does generate a lot of reports like any system would. And that's why you might really seriously consider us doing an exploratory analysis for you so we can see these things, not only put it into a visual for you that's a lot easier for you to understand and read, but we'll interpret it for you as well, because that's how you find out that this stuff is going on and that missing anesthesia has happened more than once. We find all sorts of interesting things. Okay, so you've gone through your bill item list. You've kind of tried to understand how your super items are currently being used without assuming they're being used, right? And maybe you get the exploratory analysis to help you just metrically really see the correlation and the effectiveness of use of the super items. So from there you can say, okay, these things are not being used anymore. Let's archive them. Clean your list up. When we get a super item list from a clinic, oftentimes it's really extensive. When you've got like 60 super items in there, I seriously doubt you're using 60 of them. And we'll have an example of a reason why you might have so many built out, okay? And it just makes it more confusing, because one of the things we're going to talk about is if you have related super items and you make a change in one, you have to remember to go back and make the change in all of them, okay? So you want to go through the list, okay? If you print it in Excel, by the way, because we always do things in Excel just for manipulation and stuff, it's not as easy to review, but at least you can see what super items are in there pretty quickly. Otherwise, you can do it right inside your DVMAX system, and then you can, of course, open them up. But just start with saying, what am I not really using? What do I need to get rid of? So just archive them. You can Z them or whatever you want to do, star them. I don't know that you necessarily have to get rid of it, totally delete it or anything. And then you want to say, okay, well, what do I have that I want to keep? And we're going to go through and review those and update them. And then what do I still want to have? Okay, and it can be anything from specific exam type workups. I mean, you could do a skin exam in here to make sure that you're going to have, some extra diagnostics added in, for example. You can have your typical surgeries that are in here, spay, neuter, declaw, whatever it is. And then what about your general surgery? How do you want to approach that? And we're going to talk about, there's a couple of options that you have when it comes to something like general surgery, where you could build out, 20 different surgical super items, or you could break it into core pieces. You don't have to keep redesigning the wheel every single time. You could just kind of combine core pieces. So just start with figuring out what your plan is with cleaning up this list and what you want ultimately those parent items to look like. Okay, and then we'll get to child items. At the end of this, as I'm going to tell you again, you can, check off when you're closing out that you want a copy of the worksheet. The worksheet will help guide you through this process, okay? So when I said that you could have, this giant list of, super items, this is an example of a clinic, and this is really typical too, of a bunch of related super items that a clinic has. The problem is if they change, just one thing and there's 5 of them there that are all related, just weight differences, they have to remember to do everything. And all the time when we open up, and look at the child items, there's things that are different, things that are missing, and things that are not in the same order. And we're really big on order of how things get put in here. There should be like a chronology and a chunking that occurs, because it's part of our process of making sure that we've been complete with it. And then the other part is to make sure that the client can follow along as well. Okay, so the example here is that maybe we just combine it into one parent item, okay, sedation, and whatever that difference is weight-wise, well, then we can have the options in there, because within your super items, you can determine if you want to check or uncheck, right? Like you can select items. Why not have the select mode inside of one parent item as opposed to having a whole bunch of parent items that have the rest of it built out? So think about how you could consolidate and really simplify this process. So this is one example. And then like I was talking about with your general surgery, look at it the same way, because when you've got, let's say, all of your pre-anesthetic and your anesthetic and your monitoring and your post-surgery, all of those things that are kind of core, you don't have to keep redeveloping it for every single super item there. Okay, you could have one core one that's surgically related, and then if you want to add in a code on what the specific surgery is, then that's not that big of a deal to do that. Okay, and you could do options for surgery, or maybe charge by time, however you want to do it, but you don't need to have 20 different super items that all look the same. Okay. Paul, did you have anything you want to contribute there?
No, I think you've covered it, but I mean, just to emphasize that concept of sort of simplifying the structure of things so that you, as you noted, so that a single change that you want to make in the price of some single item or some service doesn't cascade down into too many super items. To sort of organize them into structures, especially so that you can reuse them as well.
Exactly. And it happens all the time. I mean, it's just, it kind of goes with the territory. So keep it simple. The simpler it is, the more likely you are to use it, and use it consistently and accurately. Okay, we're out for efficiency and accuracy in here. Now, we've gone over the whole part of developing the super items, and that's where the worksheet really comes into, okay, like helping you to kind of structure what do we want to look at, what are some of these super items, what could they look like, okay, what are the elements that are in here. Like I said, we're not getting into the medical part of it. It is part of what we help consult on, is how do you actually develop these things and what needs to be, in those lists to be complete. Okay, so now it's like we've got it built. What do we do with it? How do we get this client to be in agreement? And I have a slide a little later kind of identifying the 3 main places you want to practice this with and how you can evaluate how well you're doing with it. So I'll just tell you right now, recheck exams is one of them, because you do something, you want them coming back, okay? Senior blood work is one of them. And one of the best ones out of all of these is dentals, especially because, like I said, Dental Awareness Month is next month. It is the hardest of the estimates to prepare because we don't always know what's going on in the mouth, right? And we might have extractions in there and what level of extractions. There's so much that goes into it. That's why we have the dental module, its own module in total. But those are just places where you can really practice your client compliance. When you can get really good in those 3 places, everything else will come out of it. Okay, so think about in terms when we go through these next slides, how it can apply to those places, okay? Think about what you're already doing, what you're not doing, what's going to fit into your own flow, because every clinic's different. It needs, whatever change you make, it needs to be as smooth a change as possible. It's really hard to get people as a group, let alone individually, to take on change, okay? But we're going to give you some of the best tips here on getting people to say, yes, I want to do this for my animal, okay? And sometimes you're actually presenting a physical estimate, and sometimes it's just verbal. So, whatever that method is, but it's in total, it's all about client compliance. Okay. Your super item is your method of having your system be as automated as possible. It does help you, though, to make sure you're being as complete as possible, too, because it's so easy to forget something in there. Some of these things are so well developed, it's like, oh, yeah, I forgot that, or I forgot that. No more forgetting when it's all built in there, right? So now we need to have the presentation. And you can't get a client to be compliant unless you get them to buy in. And this is the step. It starts top down, doctors on down, okay? It's the part that starts with the doctor. We have to get buy-in during the doctor examination in order to go to the rest of the steps. And a lot of you guys have different flows, okay? Terry's on. One of her other specialties is practice flow. So this stuff comes in again. But it's got to be part of the doctor conversation. I know sometimes the techs prepare the client, or they talk to them about different packages, or do you want senior wellness blood work and all that kind of stuff. That's a bit of a talking the client into something with them not fully understanding the impact of not doing it. Okay, that we need to do these things for a medical reason. So technicians can present, but the doctors are the point at which buy-in truly happens, because it's part of the examination flow, and oftentimes it's part of risk assessment too. So this could go for vaccines, it could go for just about anything. Okay, and then once we get buy-in, going from the buy-in to actually getting this thing scheduled, it's always interesting to me about what are the points at which we lose a client, where we don't, what are the reasons for not getting it scheduled. So we're going to go through the steps here. I just want to make sure I didn't skip something. Hold on. I did skip it. I knew there was something important here. I want you to think about why your clients don't schedule. So if you say, hey, we want to do a dental, or maybe you say, would you like to do a dental? That's kind of a joke, but it's true. When you say, would you like to, you just lost them right there, okay? Need, you're going to see need all over the place in this webinar, because that's what we want to establish, okay? But what are the reasons why someone, just using dental as the example, would not get it scheduled while they're there? So think about it. You guys you'll get the recording to this webinar. Come back to this slide and seriously think about it, and it is part of your worksheet as well, okay? The first one I have here, you don't know how often this is an issue. Like the staff never really knew that the doctor wanted to do it. Maybe it's in the notes, maybe it's not. Was it really clear that it needed to get scheduled? Or was it put on the staff that they needed to be the one to convince? Because if the staff feels like they have to convince, then they're going to feel like selling, and they're not there to be salespeople, and they're going to resist it. That's when questions like, would you like to schedule a dental, come into play. That's so passive, right? I talked to a clinic yesterday, and their technicians want to email the estimate, and then they wonder why they have no dental scheduled. That's about as passive as you can get because it's being put on the technicians to sell it. That's why we're going to go through these steps today. We don't want to be selling anything. We need to have client buy-in. They need to understand that there's a medical reason for it. And it has to be clear that it's needed, and the doctor needs to communicate that we've got to get this scheduled. So make sure you have this in your flow. You know, like, and Terry, maybe you want to talk about it for a second, because this flow thing's really important, right? Like the doctor communicating that to them.
Yes, absolutely. So this is one of the key points in getting these procedures scheduled. I think when you're in the room, if people talk about dentistry and some of the other things that aren't traumatic, with the same conviction as they would a dog that came in with a broken leg, I mean, you would never say, would you like to get this leg repaired? You would be talking in the affirmative. This needs to be repaired. Let's do this tomorrow. You'd be talking in a much different tone, in a more positive tone. So it doesn't have to be arm twisting. It doesn't have to be scary, like a scare tactic. You just have to speak with some conviction. So those are definitely some of the things that we will cover. And certainly everybody knowing their role as far as whose responsibility is it to get the dental scheduled. Do you want the technicians to do that? So maybe they can go ahead and get some blood drawn for pre-anesthetic screening, or do you wait till it gets up to the front desk? So we need to have a flow that is consistent so that everybody on the staff knows, no matter whether it's Dr. Smith or Dr. Jones, or whether it's this tech or that tech, the flow is going to be the same throughout the practice. And so the consistency on flow is something that we want to try to establish.
Absolutely. That's why I said these modules are all interrelated with each other. So don't just do this one. Make sure you do the ones that kind of are all connected with it too. The next one on the list here says estimate is expensive. If you keep hearing this back from your client, honestly, it may not be because you're too expensive. It's that we haven't established the value of what we're trying to do. Okay, so there is a way to present the estimate to help establish value, and there's also the part that if you didn't have buy-in, of course they're going to think it's too expensive. Okay, Terry used a good example about, like a real injury. People take it more seriously because it's easier for them to buy into that. And they're going to value the services you provide more. It's not that it costs more for the services to do that, right? It's these other pieces we have to pay attention to.
Well, and Kim, if I can just jump in there too, definitely there needs to be some discussion with the staff about how do you deal with objections by a client about not wanting to do a service. Everybody on your team who's going to be presenting the estimates needs to know what some of the common objections are so that they already have in their mind what to say and how to approach those objections. If the staff's not comfortable with that, they're basically going to be silent when somebody comes up with an objection, which it comes across to the client sometimes that you're agreeing with them. Yeah, it is too expensive. Sorry, I don't have an answer for that. So what are the answers to the objections? Do you accept care credit? What are the different hospital policies that you might have that could help somebody if the objection was money, or say the objection was convenience? I can't do it on Tuesdays when it's your dental day, or I need to drop off in the afternoon and you guys only accept things in the morning. Some of those things might be common sense to the practice owner, that yes, you're going to figure out the problem for this specific client to make sure that this treatment happens. but it's not always obvious to the staff. And so sometimes they just stick with, sorry, our drop-offs are in the morning, when theoretically you probably could accommodate somebody with a drop-off in the afternoon. So just think of all of those objections and address those.
Exactly, because there can be a whole list. What are they? What's at the core? What's like the basis of the objection, you know? And that way your team is trained in like how to handle these things. How do you handle objection? Because oftentimes what we think it is, it really isn't, you know? And when it's about the money, like Terry talked about, it could be that they just don't have the money. You want to make sure there's a clarity, a distinction between do they have the money or not, and do they think it's too expensive or not because they don't value it, because that's on us. Okay, and there are solutions around if they don't have the money. Maybe if you schedule your coaching session that goes with this, because it's a really important piece to help you make sure you're putting all these steps in place. It's free, it comes with the webinar here. Maybe that's one of the things you want to talk about. What are some of the objections that you guys have had, and how do you work around it? Because you need to have a protocol in place for your staff too of how to handle those things. So good point. So let's go through the steps of this. And of course, you know, the real in-depth coverage of this will be in our client compliance webinar that we'll have. So this is kind of the quick version of it. When I said it starts top down, starts with that doctor exam, whatever it is the situation, but we're just going to use dentistry as the example here. When that mouth is being looked at, when it's being examined, and the doctor determines there's some grade of periodontal disease, that is a diagnosis. Maybe we don't have all of the information yet on how extensive it is. Maybe we can't say what grade it is or what level of extractions are needed, but we know there's periodontal disease. And periodontal disease needs to be treated. We can't let it go. Now, for some of you, you don't believe in grade 1 dentals, and that's part of your medical protocol. But it is still the beginning of a disease process that does need to have some sort of action plan taken for it, okay? So when you determine that there's a diagnosis, the client needs to understand that there's a diagnosis. And they need to know what that means, okay? And a lot of you guys are good about showing them the teeth, like smell the breath. Oh, it's stinky. Look at these gums. Look at these teeth. But what does it really mean to them, right? They don't have all the background to understand how damaging it is. It's not just that it may be painful, not just, right? That's bad enough. Painful, they lose teeth, whatever, the aesthetics of it. But what about the systemic bacterial infection that can come from this? Periodontal disease is the leading cause of death, whether you realize that or not. Why? Because of systemic bacterial infection. So yeah, it needs to have something happen. And that means that the client needs to get the impact. And so oftentimes we'll show them, hey, this is the mouth. I see some periodontal disease going on here. Probably should do a dental. And you keep on talking, right? Because there's something very uncomfortable for us oftentimes to stop and pause at this point. But there's actually a reason to stop and pause. It may be uncomfortable to you when you're getting used to it, but the client has to digest what they just took in. Because this is when the buy-in happens. If you skate through it and go on to the next, they went on to the next too, okay? Senior blood work is another example. Oh, your pet's 7 years old. We should do senior blood work. Would you like to? Get rid of would you like to, right? But if you don't explain to them the reason why we need to do senior blood work and have a buy-in, and in that client compliance webinar, we've got some good methods to help you specifically with that conversion. But just for you to understand, we have to have a pause so they can digest it. They get that there's a problem here, that something needs to be done about it. Okay? I always use this kind of silly analogy, but it worked on me. I figured it worked on me. It worked on our regular clients too. But I took my car in to get an oil change. I expected to pay for an oil change and leave, right? And then what do they want to do? Sell me tires. It's like, ugh, of course they do. I didn't have buy-in at that point. They said, you need tires. They thought they were going to sell me tires by just telling me that? No. They had to show me. Okay, show me. I don't know anything about tires. Okay, they look a little worn. Big deal. I can go a little further. Until they could show me more specifically and explain to me the impact if I didn't get the tires, right? And then there was a pause, and I could digest it and buy in and deal with the fact that I was going to have to shell out money for new tires. And then guess what? I got new tires. Okay? It helps with the flow. It is part of the process. Do not rush this part. This is actually the most important part of the whole thing. Okay, so we're spending a little bit more time on it here because it has an impact. Yeah, go ahead, Terry.
One of the things that I wanted to mention too, and it can get a little awkward, and that's why you gotta have your routine down before you go into the room, is doctors, we don't want you talking money. We don't want you being the one that's going over the line item estimate. You guys are the ones in there just talking about the treatment, and then send your technician in afterwards. Tell the client, I'll have a technician who can come in and go over the estimate with you, line item. And then certainly the technician who's presenting needs to be able to address those questions, by line item if something comes up, and and get you involved for further explanation later. But we don't want the doctors in the money discussion. Okay, you guys need to be the good guys and need to be focused on medicine. Let your technicians or your reception staff or an office manager, somebody like that, let them be involved with the money.
I couldn't have said it any better, because that's exactly part of this flow. Okay, it goes from diagnosis to when we go to treatment plan. At diagnosis, we didn't talk about money. At treatment, and I'm not talking about your DVMAX treatment plan, I'm talking about the medical protocol. We're still talking medicine. Keep medicine medicine. We're not to the money yet. Money is just the transparency of what this thing is going to cost. It doesn't change what needs to be done. That's why don't collapse those two concepts, okay? So we go from diagnosis to now we have a solution for this bad mouth here, okay? We need to do a dental treatment. I do like when you use treatment as much as you can as opposed to like dental cleaning, because that sounds so prophylactic to a lot of people. We're trying to really treat a disease, so that's why we want to do that. Okay, so you talk about the medical part, like Terry was just saying. Okay, in the room, the doctor is going over that part of it. The money doesn't come in yet. We're only on step 2. Don't rush your steps. Okay, now we've got the client bought in that there's a problem, something needs to be done about it. Now they're clear on what that plan actually is going to involve. Okay, they should be already in agreement, other than they need to know how much this is going to cost. And if they don't have the money now, like Terry said, there's other solutions. They can get care credit. Maybe we book it a little further out, or whatever your plan is. It doesn't change the fact that this needs to be done. Okay, so now we get to step 3. Now we can present the estimate that has the money on it. And I know there's different conversations about how should you actually put this thing together. Should it be, we always kind of joke and call people lumpers or splitters, okay? Like you want to have everything super, super line item detailed with prices, or some of you want to just have a giant chunk of things with one price, okay? Probably the best method is somewhere in between. Don't make it too extensive of a list that's overwhelming, but also kind of show values to at least the main line items that are in there. So there's some sort of hybrid that you can come up with. That's a whole conversation for the actual putting of the estimate together. And as I said before, there should be an order to it, okay, sequential. If you're talking about surgery, for instance, you should have a pre-surgical or pre-anesthetic exam in the first position, whether you charge for it or not. Okay, it starts from the exam down, right? You got all your pre-anesthetic procedures, and then you get to anesthesia, and then you get to your procedure, and then you get to your post, you get to your medications, all of that kind of stuff. So there is a flow to this whole thing. And if you read it in line item by line item, by the way, that's so monotone, you can speak in chunks as well, okay? Like when we do monitoring, describe what monitoring involves and what, obviously they can see the price, you say the price, whatever. We do not need to be apologetic about it, especially if you believe in your fees. Okay, that's why we do fee review for clinics, so that they can understand how they're priced, And oftentimes the biggest problem for clinics is not that they're overpriced, it's that they're inconsistent in their pricing. And some of the things are just too low, actually. So that's why it's good to go through that process. Okay, the technician should never feel like this is their selling tool, like they're going to try and convince someone to do a dental or whatever it is off of providing an estimate or going over the price of something. This could be just senior blood work and they're saying what the price is. Okay, that is not the selling tool. It's just giving them the information. And I joke sometimes in here and I say, imagine if you were trying to present an estimate for $10,000, do something totally exaggerated in your head. You should not feel apologetic no matter how much it is, because it means we would be doing $10,000 worth of service, right? It didn't change the value. The value is there. So don't feel apologetic about that at all. This is the stuff that needs to be done or we wouldn't have it there. Okay, doctors do not pad these things. It is not my experience after going through hundreds and hundreds and hundreds of these things with clinics.
If I can add something there, Kim, too, sometimes the education on, justifying the fees, and I hate to use that word justified, but sometimes there really needs to be heart-to-heart conversations with the technicians. Do you have technicians who do not believe in what you're doing? If they don't have buy-in, they are not going to be presenting these estimates to your clients appropriately. So that's another thing. I mean, that, employee issues is a whole nother topic, but when you're talking about estimates and presentation, it's very important that you got the person believes in that estimate and the treatments that you're prescribing.
It's such a good point, Terry. I'm glad that you brought it up because, I mean, I've actually done coaching session with the staff specifically on that to help them to buy into the value of their own services. So we do need to consider that in there. Okay, so going over to step 4, now we need to schedule it. If we went through all 3 of these steps, we should never feel like we need to be passively asking the owner, would you like to? Right? Why wouldn't they? Let's be more assumptive than that. The animal needs it. Doctor said so. Whoever's going to be scheduling, it's their job just to schedule, right? Like it was a medical instruction to get this scheduled. Now, psychologically, the best way to do it would be with the client in the room because we're still talking about medicine, right? As soon as they go up front, they're thinking more in terms of money. If you can keep it to the medicine in the room, it will be better. Okay? So try to schedule, even if you don't have a computer in the room, that's okay. You could have looked before you went in that Thursdays is good. Thursday would be a good day for doing a dental. Okay? So you can go in and say that you can get Fluffy in on Thursday to do the dental. Just make it like this is a serious thing you need to schedule. Okay? Like when Terry was talking about the injured animal that needed treatment, well, that seems pretty serious, right? I always say if the animal needed an orthopedic surgery, would you like to schedule an orthopedic surgery? No. Obviously, the animal needs it, right? So treat it the same way, whatever this is, even if it's a recheck exam. Recheck exam has its own compliance issues, so make sure you do that module. But if you can do it in the room, that would be best. If you can't do it in the room and it goes up front, I always say that as soon as the client leaves the room, amnesia starts to set in. Okay, so you do start losing it just down the hallway. You've got to get them, if you can, before they leave that desk then. But there needs to be a communication in front of the client to the person scheduling. Doctor said Fluffy needs to be scheduled for da-da-da-da-da. Right? It's an instruction. Then the receptionist doesn't have to feel like they're selling either. They just got an instruction to schedule. So they go through and, hey, Thursday looks like a good day and get it scheduled. Keep it like that and you're going to just naturally get a real boost in your compliance.
If you can go ahead and start some of the treatments by maybe doing your pre-op when you guys are having the conversation about scheduling the dentistry, then you've already got some of that treatment started as well before they ever leave, so that with that amnesia is not so much of a problem. We've already started the treatment. We've already got this blood work going. When we come in, we're going to be set to go. So that's another little tip is to go ahead and get that started.
That's such a good point because whatever hooks you can have in here too, like doing the blood work beforehand, boy, does that make a difference. And it just depends on what the situation is. So just a little side point about, what happens if the charges end up being excessive to the estimate, because a lot of you guys will end up just downgrading whatever you're going to charge, right? Like you'll eat it. So really think about that there's some other alternatives to it. It's all about how that sheet is created too, your drop-off sheet, your surgical sheet, your anesthetic sheet, your dental sheet, whatever it is that you use. There can be some language that you use there. It's also how we communicate to the client about what the expectation is. If you make the expectation that this thing costs X amount of dollars, bam, that's it, then that's what they're going to think it is, and you're going to have a whole lot of difficulty trying to move it. So you've got to create flexibility in that expectation, because especially when it comes to a dental, you don't know what those extractions might be. And there's a lot of options to get around it. Part of it we'll talk about in the dental module. So as I've said before, these are 3 really great areas to focus on: the rechecks, the dentals, and the wellness labs, to see how you're doing with it. So you may think you're doing great. If you are great, here's some statistics for you to run for yourself. Okay, this is what we're shooting for. Now, I'll be honest with you. Oftentimes it's hard for us to calculate recheck goals on some of you, or rechecks on some of you guys, because one, you've got an exam that's combined between sick and well pets. There's so many reasons to not do that. You need to separate them. If you don't know why, schedule a coaching session so I can explain that to you. Okay, you will practice much better medicine if you separate them. The other thing is, you may have all sorts of kind of side exams that, there's the free exams and this and that and who knows what. You may have a very loose recheck exam definition. That's one of the most common problems I actually find. Because when I see a recheck percentage of 60%, I know it's a false 60%. You're not hitting 60%. You're using the recheck in lieu of a sick exam is what's happening. Okay, statistically would be an anomaly. So you want to see, do you have a clear definition of your use of recheck? Are your codes clear? And if everything is on track with that and you calculate it, your goal is to have 30% of your sick visits result in a recheck exam. Okay. On dentals, dental revenue is an average of 2.5%. Okay, that's really sad. The animals that need it the percentage is so high of these animals that come in, and yet that's all the conversion we have, that only 2.5% of our revenue on average comes in dentistry. So you want to look at your revenue percentage. That's one of the things we look at. Is it 4% or better? Okay. And then on your wellness labs, on your senior pets that you have, are you converting them? Now, you may have other well labs that you're doing. Start with senior, though, okay, because this is the one that's most common. And for some of you, you would like to institute that into your practice. But, can we get at least 1 in 5 of these to do the blood work? There's some really good reasons to be doing it. And especially with all the changing vaccine protocols that are out there right now, they're not getting the vaccines as much as they were before. And so technically there's still some money there on the table that they're willing to spend. There's a study on it. I'm not just saying it, that they're willing to spend. And so maybe they just divert it to the well lab instead of the vaccine that they're not getting because they're going to get it next year or whatever. Okay. So those are the places that you want to know what your numbers look like. And we, of course, look at it with the exploratory analysis. So, kind of reviewing everything here, and definitely when you guys sign out here, you can go through and choose what pieces that you want, because that's why it's called the Design It Yourself. This is on your terms. What's going to work for you, okay? Request the worksheet that goes with this webinar today, because it'll help guide you through some of the steps you can do on your own, okay? You get the free coaching session. Use that because that's to help support you in utilizing the stuff that you learned today. And maybe there's some questions that you have. Maybe there's something totally in a different topic. Whatever. I'm fine with coaching you on whatever is going to be helpful. So you can either check it off when you're signing out, or you can go to calendly.com/KimFish. Gosh, a bunch of you have already scheduled with me, so that's great. So go ahead and put that down on your calendar. And Paul was talking about it too, because he gets the value of the exploratory analysis. And Paul, maybe you want to say something again about it. This is one of the most important things you can do for your practice, okay, is to know how you've been performing and why it's gone this way, the good, the bad, and the ugly. Because how can you move forward if you don't know that information? Yeah, go ahead, Paul.
Yeah, if I can just jump in, I always mention this because you've seen some of the charts and graphs and analyses that get done. But it really, the exploratory analysis gives you a tremendous value and great insights into what's going on in the practice at a very low cost. And it also shows you some of the depth that we can provide in terms of analysis of the data, in terms of examining what's in there and showing you things in simple forms. Those charts, particularly the time-based charts, are the best examples, but there's a lot of other ones that you would see as part of the exploratory analysis to point out areas that are worth paying attention to in terms of improvement and changes or opportunities that you may want to take advantage of. And they just present that information in a very easy to grasp form that you could very quickly say, oh, look, we have this discrepancy or this issue cropping up, and then turn to the consulting service to kind of address it and change or improve that situation.
Yeah, great summary. And it's really meant to have, again, a return on investment for you. So the information you get out of the exploratory analysis should definitely help you move your practice forward, and you'll do better just from the analysis there. And then in the individual modules that you're interested in, you can do the group coaching, and of course you can do the full individual consulting when you want to maximize your peak performance. So it's really what it is that you're looking for your practice, and we'll help guide you. You know, some of it you may want to do on your own, and some of it you may want to have help with. Ultimately, you want to practice to the best of your abilities there, both medically and operationally. Okay, always be building the value of the practice, and that's what we're here to help support. So I don't know if anybody has any questions. I don't see any. A lot of you guys just save your questions anyway for the coaching, so that'll be fine. So I will let everybody go at this point. Make sure that you check off what you want at the end when you're logging out, and feel free to get in touch with us anytime. And I hope that you guys come on for the rest of the webinars, because they really are kind of all interrelated, as you see, and we'll have, you know, like rotating consultants come on for each of them. You get to know everybody. We've got a really great team, and I'm so proud of everybody. So thank you all for coming on and spending this hour with us, and we look forward to having you on again, and whatever we can do to help you, that's what we're here for. So thanks, and have a great day.
Thanks, Kim. Thanks, everybody.
Thank you.